Good afternoon, sir. I am Carol Faith S. Asuncion, your student nurse for today. And today we are going to assess your thorax and lungs. Your name is Kenneth Barros, sir. Am I right?
Yes,
How old are you, sir? Again?
I'm 18.
Okay, 18 years old. So, are you aware, sir, that in assessing your thorax and lungs, you need to remove your shirt?
It's okay.
Okay. Are you comfortable, or you need someone to? Okay.
It's fine.
Okay, thank you. Do you mind, sir, if I ask you some questions about your family history? Do you have any illness? Your families, do they have any illnesses? They feel like cancer, allergies, like that, something like that?
No,
Thank you, sir, for answering my questions. So we may now proceed, sir. Okay, so you may now take off your shirt and stand up. Okay, sir, I'm going to inspect the shape and symmetry of your thorax from posterior and lateral views. Okay, sir, you may now turn around and I am going to inspect now your anterior thorax. Thank you, sir. Can you bend over for me, sir? Okay, sir, you may now sit. So, sir, can you show me your back for me to palpate your posterior thorax for the temperature and integrity of all chest skin? Palpate the posterior thorax for respiratory excursion. Place the palms of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Okay, sir, as I touch your back, can you please say blue moon or 1, 2, 3 for me to palpate the thorax for vocal or tactile fremitus, the faintly perceptible vibration felt through the chest wall when the client speaks.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Percuss the thorax. Percussion of the thorax is performed to determine whether underlying lung tissue is filled with air, liquid, or solid material and to determine the positions and boundaries of certain organs. So I am going to auscultate your thorax now. So can you please breathe deeply for me with your mouth open? Auscultate the thorax using the flat disc diaphragm of the stethoscope.
Jungle.
Sir, we may now proceed to the anterior thorax. We may now turn around, sir. Inspect breathing patterns. Inspect the costal angle and the angle at which the ribs enter the spine. Palpate the anterior thorax and palpate the anterior thorax for respiratory excursion. Palpate the tactile fremitus in the same manner as for the posterior thorax. Okay, sir, may I request you to stand for us to have a better viewing of the anterior thorax. Palpate the anterior thorax for respiratory excursion. Sir, please take a deep breath while I observe the movement of your lungs. Forecast the anterior thorax systematically. Begin above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Compare the lung on one side to the lung on the other. Okay, sir, as I auscultate your anterior thorax, please take a deep breaths with mouth open for me, sir. Thank you.
Bakit wala kang panty? Ba't wala siyang panty?
Okay, sir, thank you for your cooperation and you may now put your shirt on. For the results, sir, your thorax is symmetric, spine is vertically aligned, spine column is straight, right and left shoulders and hips are at the same height. Skin intact and uniform in temperature, chest wall intact, no tenderness, no masses, full and symmetric thorax expansion, and fremitus is heard mostly clearly at the apex of percussion notes resonate except over scapula. Lowest point of resonance is at the diaphragm. Vesicular and broncho-vesicular breath sounds is quiet, rhythmic, and effortless respirations. Costal angle is less than 90 degree and the ribs insert into the spine is approximately a 45 angle. Full symmetric excursion and bronchial and tubular breath sounds are in normal. So, sir, everything is normal and any clarification, sir?
None. Thank you.